Hello everyone, we are Team Ikilon and this is our project demo for chronic disease management system. So let us start. First, when the patient will onboard on our system, he can take an basic AI risk assessment test. This will involve general question like age, gender, height, weight for calculating BMI, then other general questions. And based on this, he will get a basic prediction whether he is having a risk of heart disease, lung cancer, or diabetes. And next, after going to this, he can take a specialized test for each of the chronic diseases. Now I will just show the sample test. As you can see, after inputting sample values, I can get the risk assessment score. Now currently it shows 99% of risk assessment score because I have given values which are over the limit. And basically, in the same way, you can take other assessment for hypertension and heart diseases. Now all the diseases have different types of questions in them, and from based on this, your risk score will be calculated. Now, what to do after you get your assessment? So you need to go to the doctors. So we also have appointment section where you can book appointment with the doctors according to his specialty. Here you can filter out doctors based on his specialty. I will just book an appointment with neurology surgeon. Here I can select the date of the appointment. I can select the time slot, and hence I can confirm the appointment. Yeah. So my appointment has been booked. Next, I can also chat with the AI companion regarding various issues, like I am facing some issues with the website or some other issues related to my daily life. I can chat with it with Care Companion. Now I will just show the demo. Hello.
Hello there. How can I assist you with your health-related questions today?
I am not feeling quite optimistic today.
It's understandable to have low moments. If it persists or affects your daily life, consider discussing it with a mental health professional.
As you can see, the AI assistant not only gives the textual but also audio response, and along with it, it shows values for different sentiments of the patient. Like disappointment is 100% as I was not feeling optimistic today. Then I can also end the call and I can start a new conversation anytime. Next is the diet plan section. Here, users can customize their diet plans. So according to basic questions like according to his health activity, then how his diet should be specific, like vegetarian and low carb diet, then some allergies or intolerances. So I will just input some sample values, and now we can generate a 5 days diet plan. Here we need to input the budget. According to it, our AI model will assess the user and will generate a personalized diet plan for him. As you can see, there are three diet plans generated. And among these three, these are of various types for protein, carbs, and fat percentages. The first one has 40, 20, and 40 percentage. Next one has 35, 25, 40. Next is 30, 15, 55. All the 5 days diet plan has breakfast, lunch, dinner, and snacks included in them. And among these three diet plan, you can also see the valuation has also changed, like 4,500 per week, 4,000 per week, 4,200 per week. And also calories have been given for each diet plan. Now, if I select some sample diet plan, I can also download that plan from the download plan button over here. Now, if the user faces some issues related to his mental health, so he can also assess that using the mental health section. Here we can answer some simple questions related to the mental health, and we can view our mental status. Here we are also given a field for giving input through your audio so that our model will analyze your voice, and according to that, he can assess you on various parameters like nervousness, etc. Today was a great day. I had fun at my work. I finished my job early and went home to my family. Today was a great day. Here you can preview your recorded audio. As you can see, our AI has given a mental fitness score to the user. It is a good score. And the smoothness in his voice, these are the voice analysis, the clarity, crispness, the speech rate, then energy, liveliness. Now, these are various parameters according to which you can assess your mental health. Next, now this is the progress board, a Kanban board. Here you can put in some activities like I will input for medication. I can also drag and drop the task from in progress section to finished section. I can also add a new column and I can also add new tasks. Next is the calendar section. Here you can view your appointments with the doctor or the medicines which you need to take. After getting some medicine, you can check mark here, and as you can see, whenever you take some medicine, points are being rewarded. So this is a reward-based system to keep the patient motivated for taking their medicines. Next is the community forum. Here you can talk about your chronic diseases or some other stuff with other people. Next is the health system, health education section. Here you can see the news related to health topics and also videos related to them. Here you can also search the videos. One more section is there for report section. Here users can upload their lab reports. Like if I have taken a sugar test, I can save my files over here for easy access. As you can see, these tests are all saved in this section, and you can also edit the test data if you need afterwards. You can also delete the reports from the delete button. Next is so this is the doctor side. Here you can see that we have received two alerts that you have two pending alerts. We will go on to that in further. Now, this is the doctor appointment section. Here, the appointments which were scheduled by the patients can be seen by doctor. And here you can see all the details regarding the appointments are given. The reason for the visit is also given. Here, doctor can either confirm the appointment or cancel the appointment. I can confirm appointment of one patient and also cancel appointment of other. All the appointments are listed over here for easy access for doctor. Now, after booking some appointments, if the doctor has conducted his visit and he needs to prescribe some medicine to the patient, so usually what we do is doctor writes the prescription, but here we have improved that, and doctor can directly from the give the audio-based prescriptions. Paracetamol 3 times a day before lunch, aspirin 2 times a day after lunch. Patient name is Manglesh Nimbalkar and hospital name is Nama Hospital. They continue this for 10 days. Now here you can see I have given all the instructions as a doctor. After processing by the AI model, the prescription is generated. Here you can see the hospital name also is being written. The doctor name is given because I logged in from that account. The patient name and the duration of the medication is also listed over here. All the medicines which I have told are also given here. Timings along with the instructions for the medicines. I can also download the PDF file of this medication and I can also perform actions like editing if as this is a AI generated, so we can there can be some mistakes. Now I can also edit this and change this. Now after taking the medication, if some patients face some issues, so we can also see a section of patient statistics. Here doctor can view all the patients and their names, their diseases, and the priority. Now this priority we can sort this from high priority patients to low priority. Now, the patient which require more attention by the doctor are listed above. Here, I can either schedule an appointment with this patient immediately, or I can either contact him. I can also search the patient and also filter out the patients with different priorities. Now, what about the patient tracking? So we have also included aerial view of the doctor, like if doctor is present at present in Kondwa. So here you can see the doctor's location and the nearby patient locations. Now you can see the patient name as well as his symptoms and also the distance from the doctor. So like this, the doctors can get overall overview for how long the patients are situated. Then if some patient needed a high priority, so they have the alert system is also provided for the doctors. Like there is some patient and he needed an annual health checkup, and the date and the time of the checkup is given. So all these notifications are received by the doctor. As earlier, uh, the alert has came, so it was the same alert, and it showed two new alerts. So these are the two new alerts which are shown to the doctor. Now this is the doctor dashboard. Here you can see the total patients which have been medicated, the daily appointments, the patient satisfaction ratio. Then the patient trends, what are the patient, how many patients visited him. Then the appointment quantity, like how much appointments are being conducted with the doctor. And he can see what types of appointments are there, like cardiology department, then neurology department, etc. Thank you.